What are the symptoms? So if somebody is feeling these 4 or 5 symptoms, they know that they could potentially be having sleep apnea. What are those symptoms?
As I said, mild. Mild means it's the beginning of the disease. When I say severe, it takes about 20 years to get into that stage. So in 20 years, it goes slowly, get worse and worse.
Does this symptom come at the very beginning or only when you move from mild to moderate?
I said sleep disordered breathing problems. It's a spectrum.
Right.
The starting point is snoring. If 100 people snore, 30 people will have sleep apnea.
Which doctor do you go to for this?
It's a little bit confusing for the patient whom to see.
Yeah.
Okay.
Who is the right person you go to?
So most of the time managed by many specialties, mainly by the pulmonologist, chest physician, if they're trained in sleep. Neurologists can do it because they do EEG. Sometimes they also do the sleep sleep clinic. And ENT, ear, nose, throat, they also do the sleep.
So Doc, in spite of there being 3 specialties that are trained to detect this, why is this so underdiagnosed and underdetected in our country?
As I said, it's a specialty. So 80% of the patient goes to family practice or MD medicine. Okay. So they are already busy with the hypertension, diabetes, so many things.
Hello everybody, this is Namita Thapar, Executive Director of MCure Pharmaceuticals, and today we're going to be talking to an international expert, Dr. Mohan. He has practiced as a chest physician for 15 years in the US, especially in Delaware and New Orleans. And today he's going to talk about his expertise in sleep apnea. This is one of the most underdiagnosed, or should I say late diagnosed conditions that can cause a lot of complications. So doctor, let's get educated on this important topic. Let's start with, in very layman terms. What exactly is sleep apnea, OSA? We keep hearing these terms. What does it mean?
Thank you, Namita, for inviting me for this talk. So sleep apnea is the air getting blocked in the back of the throat while you're sleeping. It can be mild to moderate to severe. What is the meaning of this is the air getting in the back of the throat can be obstructed partially or completely. So oxygen supply to the lungs get up and down in the night.
Okay.
When there is up and down oxygen fluctuation in the night, the brain senses that oxygen is not going in the system. So brain will send a signal to the person to wake up.
Okay.
So basically you have a disturbed sleep in the night that makes you tired, and a lot of symptoms can come in the morning, day-to-day life. In the long run, it's going to make a lot of medical problems.
So let's talk about both of these issues that you brought up. Short term, what are the symptoms? So if somebody is feeling these 4 or 5 symptoms, they know that they could potentially be having sleep apnea. Yeah. What are those symptoms?
So what I say is sleep apnea divided into central sleep apnea, obstructive sleep apnea, mixed sleep apnea. What I'm going to talk about is obstructive sleep apnea here. As I said, mild. Mild means it's the beginning of the disease.
Right.
When I say severe, it takes about 20 years to get into that stage. Okay. So in 20 years, it goes slowly, get worse and worse. The beginning symptoms are like you getting, morning when you get up, you get morning headaches. In the nighttime, you might have to go to urinate more times. In the work, you might feel like you're tired. Somebody's talking, you'll be sleeping. You feel like not energy. This is how it starts.
Okay.
So in the nighttime, they might think they're sleeping nice, but they have a disturbed sleep because brain is constantly sending them to wake up.
Okay.
So as you go, what happens is you start to gain weight because of this disturbed metabolism in the body. A lot of stress hormone goes up. So you start to gain weight in the back of the neck. The neck girths will go up. Okay. Stomach will come up. So this will make it further moving into the moderate to severe sleep apnea.
Okay.
So we have to detect early to prevent these symptoms. For example, I will tell you when you get to moderate severe, if you're driving, for example, on a highway, you might see a lot of accidents, especially in the afternoon time or early morning. Some of it might be coming from sleep apnea because they will be getting the sleep, they lose control and they get into accident.
My God.
For example,
if you're an
airplane flyer, in US we need to check for the sleep apnea before they fly. So any high risk driving need to check for sleep apnea.
You know, one symptom that's very common, and I was seeing this documentary by Shaquille O'Neal, who has sleep apnea and is talking a lot about it to raise awareness in the US, is snoring. His wife said that he was snoring so much that he had to go get tested, and that's when you realize it was sleep apnea. So does this symptom come at the very beginning or only when you move from mild to moderate?
Okay. I said sleep disorders, breathing problems. It's a spectrum.
Right.
The starting point is snoring.
Okay.
If 100 people snore, 30 people will have sleep apnea. Not everybody.
Okay.
Snoring means it's just a vibration in the back of the throat when they get narrowing.
Okay.
You don't usually have narrowing of the part. It's just a vibration because of that. Most of the patients come to me, not the males don't come to me. The wife brought them to my office, saying that in the night time they're sleeping, they choke and they wake up. Choking means they get blocked.
Right. Right.
They make that sound and wakes up. And the wife says, I'm watching him, he doesn't sleep, then I have to wake him up.
Right.
So they get scared, they bring it to the office.
Understood.
Most of the cases comes like that. It's already a little bit late when they come to that stage.
Right.
So snoring is symptom, but not everybody who snores has sleep apnea. Having said that, we have to test for sleep apnea because they might get into sleep apnea moderate to severe later on.
Let's talk about this point, the tests.
Yeah.
So in that same Shaq video, I saw him, all the nodes, and it seems like and he had to sleep all night with it and then get tested. It seems like a very difficult test.
It's not a difficult test. There is nothing invasive. It's just a monitor like if we might have got an ECG, we might have put the electrodes.
Absolutely.
Same thing.
Yeah.
We put few electrodes in the brain to catch the brain activity. One electrode in the chest or two to see the chest rising, or one or two in the abdomen and in the limbs.
Right.
In the US, usually when you do sleep test, we do in the video polysomnography.
Okay.
It's like in the separate room with the video, and you watch for all night. It's too expensive. We have here in Pune, but it's too expensive to affordable for everybody. What we do in India is depending on the severity, we do at home.
Okay.
It's not as exactly as sophisticated as the regular sleep test, but we get some idea that whether they have the sleep apnea or not.
Right.
So it's called home sleep testing. Testing. The person will come and hook up. Then in the morning we come and take it out, the small recorder, and we go through the recorder, say,
and then you get an idea.
How many times the air is blocked, how many times the oxygen going down, are they waking up how many times.
Okay.
So and we'll calculate apnea, hypopnea index. Apnea means 10 seconds air getting blocked.
Right.
Hypopnea means 30% air blockage, and we calculate per hour.
Okay. Number of episodes per hour.
Then we say mild, moderate. Say mild means less than 5 per hour.
Right.
It's index. And 5 to 15 we say moderate. 15 to 30 we say severe. More than 30 is very severe.
Okay. So those are based on the number of episodes, you figure out the extent of severity.
Of severity.
But tell me something. I mean, fine, we know what sleep apnea is now. Thanks to you, we know the symptoms. Which doctor do you go to for this?
It's a little bit confusing for the patient whom to see.
Yeah.
Okay.
Who is the right person you go to?
So most of the time, it's managed by many specialties, mainly for the pulmonologist, chest physician, if they're trained in sleep lab and things, they are the one to equip. Neurologists can do it because they do EEG. Sometimes they also do the sleep sleep clinic. And ENT, ear, nose, throat, they also do the sleep.
Okay.
So these three people.
So 3 points of contact, the chest physician, the neurologist, or the ENT specialist. These are the three you would go to because they would be able to detect
fast.
So in spite of 3 specialties being your point of contact, why is it so underdiagnosed in a country like India?
As I said, it's a specialty. So 80% of the patient goes to family practice or MD medicine. Okay.
Makes sense.
So they are already busy with the hypertension, diabetes, so many things.
Right.
The thinking of obesity or sleep apnea is a little bit under the radar. So patient not getting aware, so they get delayed also. When they come to me, ironically, I see them in the ICU.
Oh, so when it's gotten already pretty extreme.
They are sleeping, they're in the daytime, the heart is weak, they got swelling, heart failure. Then I said, this is happening for the last 30 years. So one by one started to come the obesity, hypertension, arthritis, heart failure, then getting sleep, then again weight getting worse. They end up in the end. So especially people who smoke, like a COPD with sleep apnea, its mortality is very high. The chances of they dying from the heart failure are very high when they reach.
Because smoking just makes it
Smoking
worse.
makes the lungs pipes to get
Right,
narrowed.
right.
Already you have oxygen not coming down, lungs are not catching more oxygen.
Right.
The heart has to pump, work hard. The heart gives away.
Right. Absolutely.
So early detection is very, very important.
So that you can avoid all these
Yeah,
complications.